Here is something about liquor amni-embolism and pulmonary embolism. Liquor amni-pulmonary embolism implies embolism caused by embolus made up of thromboplastin-rich liquor amni containing debris blocks the pulmonary arteries and triggers the complex coagulation mechanism which can lead to DIC, disseminated intravascular coagulation. There is massive fibrin deposition distributed throughout the entire pulmonary vascular tree. Besides hemorrhage from various injured sites, wounded sites, the most serious complications or symptoms of pulmonary embolism or pulmonary amniotic embolism is sudden collapse with acute chest pain and air hunger. Signs include cyanosis, increased respiratory rate, cardiac failure, and distension of jugular veins. Death usually occurs within short time from shock and vagal inhibition. The pulmonary amniotic embolism as a complication of pregnancy with these signs and symptoms can be diagnosed confirmedly, and we can start its management and treatment very soon to save patient life by checking cardiac failure and sudden collapse. Consequently, steps of active treatment or management should be, first of all, oxygen therapy and cardiac massage. Secondly, should be given thrombolytes like streptokinase with loading dose of 6 lakhs unit and can continued with 1 lakh unit per hour. The good thing of this is it doesn't cross the placenta when used during pregnancy. Relief from chest pain is mandatory for the patient comfortability and cooperation. For this, morphine 15 mg IV should be started. Next is heparin. Intravenous heparin bolus dose of 15,000 international unit is given. Since patient is going through cardiac failure and shock, blood pressure must be maintained. This is maintained by dopamine and if need adrenaline. Tachycardia is counteracted by digitalis. In pulmonary amniotic embolism, the severe cardiopulmonary embarrassment stimulates thromboembolic phenomenon. There will be severe clotting defects with profuse bleeding per vaginum or through the venae puncture size or injured vessel size due to consumption of coagulation factors. This is due to recurrent and repetitive formation of clot and its lysis. In this, fibrinolysis is secondary and fibrinogen depletion is primary, which leads to DIC, disseminated intravascular coagulation. What's the cause of occurrence of both simultaneously? The clot formation and then fibrinogen depletion and fibrinolysis, which leads to hemorrhage from the different sides, despite of recurrent and repetitive clot formation. Thromboplastin liberated from damaged decidua and uterine musculature and already formed clot, while side by side increased production of activators from the damaged capillary endothelium. We know activators, as example urokinase and streptokinase, triggers the fibrinolytic activity and causes defibrillation. Question is, despite of repetitive clot formation, even the fibrinolysis which is occurring simultaneously, bleeding can't be checked. This may be due to fibrinolysis overwhelmed the clot formation. Here a vicious cycle created. Embolus in turn causes shock, and because of shock, synthesis of essential coagulation factors fails to occur promptly, and it can't overcome simultaneous activated fibrinolysis and fibrinolytic chain. What's the pathological conditions or causes of this coagulopathy? These are abruptio placentae, endotoxemia due to septic avulsion, chorioamnionitis, pyelonephritis in pregnancy, Liker embolism, severe preeclampsia, eclampsia, and HELP syndrome, installation of intra-amniotic hypertonic saline, dextran infusion, hydatidiform mole, shock, caesarean section, and prolonged retention of dead fetus in utero. All these clinical conditions may trigger the delicate hemostatic mechanism either by endothelial injury or by release of thromboplastin and phospholipids. Because of the hypercoagulable state in pregnancy, presence of any provocative factor can easily upset the normal balance, culminating into disseminated intravascular coagulation. In this, besides fibrin, all other constituent factors are consumed. That's why it is better to say it conjunctive coagulopathy despite of defibrillation syndrome. Prevention and curative management of this coagulopathy next time. Thanks. Here is something about Liker amniembolism and pulmonary embolism.